welcome back to another Cup of Joe. This week we're going to talk about our favorite topic, insurance, health insurance. And as it is a new year, things sometimes change, and we're going to go over some of those changes and make you aware of what that might mean for you and your family in your health care. So, the first question, of course, is why should I review my insurance policy? And the answer is lots of things can change. The network of providers can change. The deductibles can change. The amount that you pay when you go see a physician's office can change. So we've got a lot of different aspects of change that might happen, and we'll go over some of those in the course of these questions. So one of the common things that employers do is they change the structure of their insurance plan so as to manage the costs and to try and facilitate people making maybe healthier choices or less expensive choices or what have you. And so people will change the deductibles, so how much you have to pay out of pocket before insurance kicks in. They will change how much you have to pay sometimes when you go to see a physician or a certain type of physician. So they may make it more expensive to go see a specialist or less expensive to go see a primary care physician or less expensive to go to an urgent care versus an ER. I mean, there are a lot of different ways that you can mold a plan to produce the result that you're trying to produce. So you have to review this carefully so you can kind of alter your behavior if you need to alter your behavior to reflect those, to address the changes that has been made in the course of the year. Does my deductible reset? The answer is yes. So generally speaking, I don't know that anybody has plans that renew in mid-year, but if your plan expires or renews every January 1, then you get a new deductible every January 1, which is a kind of an interesting thing because it induces people to push off healthcare needs until the end of the year, and then we get really busy in hospitals when people have met their deductibles, and therefore insurance is covering the normal amount, the 80/20 or whatever the plan that you have. What is my out-of-pocket maximum is sometimes people ask, and the answer to that is, so most plans have a sharing model. So the insurance plan pays, generally speaking, 80% of the cost of the care in a hospital or surgery center or what have you, and the patient pays 20%. Well, once you've hit your out-of-pocket maximum, then the insurance plan pays 100%. You don't generally want to get there because that means you've had some pretty big healthcare needs over the course of the year. But nevertheless, if you do hit your out-of-pocket maximum, the insurance plan kicks in and pays at 100% thereafter. What preventative services are provided at no cost? This can range, depends on your insurance company, your employer and the insurance that they've chosen and the plan that they've chosen within the insurance company's offerings. For our hospital, there are a lot of things that have no out-of-pocket associated with it whatsoever. And the intent there is to induce our employees to choose those options that we think are good for, say, preventative health. And a lot of employers will do that. They will put in no cost for services that are going to help you maintain your health. I couldn't tell you exactly what those preventative services look like because they change from employer to employer and insurance company to insurance company, but they're a wide variety. For example, we have a health screening that is done every year by our insurance company, and what they'll do in that health screening at no cost, it's done on a Zoom, is they'll provide us advice if they notice indicators that might suggest that we have an issue that requires more attention. And the whole idea is early identification can lead to a much lower cost and much easier process of addressing the health issue. So let's talk about one of the big things that happens, especially when you change insurance carriers. So you go from, say, a Blue Cross to a smaller plan, maybe a Cigna or something like that. And you can find that when you change the insurance company, the network of physicians and hospitals and surgery centers, et cetera, that you have to choose from changes too. And this is really disruptive and really annoying, but it's the nature of the beast because not every insurance carrier has a contract with every physician and every healthcare provider out there. So you need to look carefully at your network and make sure that the physicians that you use and the other types of services that you use are in the new network, because otherwise you're going to show up and they're going to hit you with a huge bill, which is not something any of us want to encounter. And you don't want to be waiting until the last minute to address this, because if you do, then you might find yourself in an awkward position of having to scramble to find an alternative doctor, etc., because the one that you have is out of network and they're going to want $350, $400 for an office visit. I don't know if that's the case, but that is very possibly the case. So just be aware, networks are the hidden challenge to changing insurance carrier. In any case, thank you very much for joining me today. I've hopefully shared something that is of value, and I'll look forward to seeing you next time on A Cup of Joe.